A health system in crisis, the SHA Under Fire. The Social Health Authority, or SHA, was launched with a promise to provide affordable and accessible health care for all Kenyans. However, the reality has been marred by challenges, sparking outrage among citizens and sharp criticism from Kenyan Members of Parliament. System downtimes have become frequent, creating bottlenecks that leave patients stranded and helpless. The once simple process of seeking medical care is now riddled with lengthy approval procedures, adding another layer of frustration to an already strained system. The heart of the matter lies in the SHA's implementation. Kenyans, accustomed to the previous system, are now grappling with a new and seemingly cumbersome process. The complaints are not merely about the technology itself, but about the human impact of these technological failures. Patients are being turned away from hospitals, their hopes of treatment dashed by system errors and bureaucratic delays. Voices of dissent, Kenyan MPs Speak Out. Kenyan MPs, representing the voice of the people, have voiced their strong disapproval of the SHA's shortcomings. Majority Leader Kimani Ichung'wah, a prominent figure in the government, has directly questioned the SHA's capacity and competence in handling the nation's healthcare. "We cannot afford to have a system that fails our people in their hour of need," he stated, echoing the sentiments of many Kenyans. Suba North MP Millie Odhiambo, known for her no-nonsense approach, has proposed a radical solution: revert to the previous system, the National Hospital Insurance Fund, if the SHA does not show significant improvement within 6 months. These calls for accountability are not limited to a few vocal MPs. A chorus of voices from across the political spectrum has risen, demanding immediate action. Peter Salasya, Anthony Kibagendi, Eva Obara, and Faith Gitau are just a few of the MPs who have raised concerns, highlighting the widespread dissatisfaction with the SHA's performance. Beyond the SHA HIV funding uncertainties, the SHA's struggles are unfolding against a backdrop of broader uncertainty in the healthcare sector. The U.S. government's recent temporary suspension of foreign aid for global HIV treatment, though later lifted, sent shockwaves through Kenya. The suspension raised concerns about the future of HIV funding, particularly for crucial preventive drugs and other essential services. In response to the crisis, Health Director General Patrick Amos has assured the nation that the Ministry of Health is actively seeking alternative funding sources. The uncertainty surrounding HIV funding has added another layer of complexity to an already challenging situation, highlighting the country's reliance on external support for vital healthcare programs. Seeking solutions, a nation's health at stake. The current healthcare crisis in Kenya demands urgent attention and decisive action. The SHA's operational failures, coupled with the uncertainties surrounding HIV funding, have created a perfect storm, jeopardizing the well-being of millions of Kenyans. The call for accountability from MPs is a clear signal that the status quo is unacceptable. The Ministry of Health faces the daunting task of not only addressing the SHA's technical issues but also restoring public trust in the system. The coming months will be critical. The government's response to these challenges will determine the future of healthcare in Kenya and ultimately the health and well-being of its citizens.